Dr. Bertagnolli, welcome to the HELP Committee and congratulations on your nomination. A number of us on the HELP Committee are also on the Appropriations Committee, and I want to address the budget for the fiscal year 24. Despite the challenges that we had faced in writing a labor HHS appropriations bill, because it included the availability of less funding overall than we had in fiscal year 23, our bipartisan fiscal year 24 bill builds on our longstanding commitment to NIH and biomedical research in general. We secured critical increases in our bill for some of the agency's most important programs: $100 million increase for mental health research, $100 million increase for Alzheimer's disease research, $60 million increase for cancer research, and $12 million for a new palliative care research program. So as a cancer researcher, I wonder if you can describe how the recent investments in NIH and specifically in cancer research have advanced care for patients and improved outcomes. But I also want to challenge you to talk about the impact that the House passed, I'm sorry, not the House passed, the House bill that's pending that has drastic cuts in biomedical research, how you would tackle that if that became law.
So thank you, Senator. First, let me say that I speak for everyone at NIH to say that we are deeply grateful for what we receive from the federal government in order to conduct our research. And then number two, let me speak as a physician to say that over my 30-plus years of being a physician, I have seen the tremendous advances that have been made as a result of NIH funding. I'm not going to take down the clock in the many advances that have happened just in the last year. Just let me assure you that people are living better, longer, as a result of NIH research. I think that you are also asking to address how changes in funding will impact what we do. I will just say that every penny we get, we will use to the fullest extent possible to secure health for the American people. We will focus on the issues that Congress brings to us as important, and I really embrace working with you on those key issues. And then finally, if our budget, there is a chance that our budget will force us to leave opportunities on the table because the opportunities are enormous. And I'll just leave it there.
Okay. There have been two biosafety incidents involving the H5N1 virus at the University of Wisconsin-Madison. In both cases, there was a lack of guidance and oversight from NIH, which I find very, very concerning. As chair of the Labor HHS Appropriations Subcommittee, I worked to secure language and funding focused on this issue in our bipartisan fiscal year 24 bill. In addition to directing NIH to articulate the roles and responsibilities of investigators and institutions conducting this research, the fiscal year 24 bill would establish for the first time an office at NIH to serve as a resource and to provide tools and guidance to the research community. Dr. Bertagnolli, what steps would you take to enhance the oversight of NIH funding research involving potential pandemic pathogens?
Thank you very much for your advocacy for this very, very important issue. You know, potential pandemic pathogen research stands to achieve great benefit for people by allowing us to respond immediately and save lives, but it also has risk. And I can commit to you, if confirmed as NIH director, that I will fulfill the highest possible oversight for programs that engage in this kind of research, not review and oversight to make sure that they are conducted safely and achieve the benefit we know we can see for the American people.
Thank you, Mr. Chair.